Hello to all listeners. You're watching a presentation of Making Space Matter, the path to the childcare and early learning facilities our kids deserve, a project of Local Initiative Support Corporation, or LISC, our national childcare team in collaboration with the National Children's Facilities Network for its Making Space series. My name is Cecile De Laurentiis, the Assistant Program Officer for the LISC National Childcare Team. I was part of the lead staff team on this project. My colleagues, Bevan Parker-Cherkes and Cindy Larson, were instrumental in shaping the project vision, goals, and work, bringing decades of experience in this work to the project. While they're not here today, I will be speaking with our expert project consultant, Maggie Lee O'Neill, about our experience with the project. Making Space Matter aimed to gather resources on childcare facility development to develop a report and create a new toolkit that local champions across the nation can use to actively plan for the interconnected system of supports needed to finally get kids and teachers into the spaces they deserve. This project was made possible thanks to funding and support from the Buffett Early Childhood Fund and the Heising Simons Foundation, with special thanks to Eric Buchanan and September Jarrett. We also have other consultants to thank that worked with us on this project, including Studio MLA Architects, Amy Friedlander, and Clarion Research. So first, I want to take everyone through a quick thought exercise. I'm going to move through some slides with images of real childcare facilities. As I advance the slides, I invite everyone viewing to think about how you feel when you see the images. If you feel like it, write a few of the things that come into your head when you see these images. And I'll just keep scrolling through. Some different kinds of images coming up. So I'll highlight a couple of really important things here as you kind of think about and sit with any of the thoughts and feelings that came up as I move through those images. The first set of spaces you saw are fully compliant with licensing and regulations in their jurisdiction, but are they places that you'd want to spend your time? And then the second set of spaces, it's important to keep in mind that not all spaces are unpleasant. Good spaces do exist, and we are capable of making them. So why don't we have more childcare facilities that give us some of the more positive feelings or thoughts upon seeing them? So much of what really matters in childcare space has been known and is well established through research for decades, primarily dating back to the 1990s, but also as far back as the 1970s. A multitude of tools, resources, and writing exist on this subject. Originally, we sought to conduct a literature review and identify what research exists while tracing a history of childcare facilities funds. But within a couple of months of attempting this project, it became clear that the need was beyond just talking about components of facility funds, and we needed something more actionable. So then the question becomes, how do we finally make space matter? How do we raise up the information we already know, spur urgency in needed ways, and provide tools needed to transition knowledge into action? How do we concretize the knowledge and resources that we have on hand? So this is the set of activities that we came up with ultimately. Investigating early learning facility supports in different geographies, talking to experts in the field about what action is needed, and developing a comprehensive toolkit for state and local administrators to use to build out this system of supports. Now I'm going to turn it over to our expert consultant, Maggie, to talk about her experience conducting this initial literature review.
Thank you, Cecile. To kick off the Space Matters project, we started with research. Truthfully, I was completely unaware with the realm of early care and education, so I was elated to conduct this comprehensive literature review. I pulled resources across a multitude of sectors in an effort to clearly define and articulate the specific attributes of physical space in ECE environments that should be considered most essential to child well-being and provider success. This slide shows an abbreviated version of the timeline we put together on the history of ECE research in the United States. The following quote is from a position statement issued by the National Association for the Education of Young Children in 1997. Emerging research on brain development indicates that the degree of responsive caregiving that children receive as infants and toddlers positively affects the connections between neurons in the brain, the architecture of the brain itself. Given the proportion of children who spend significant portions of their day in settings outside their family, ensuring these environments promote healthy development becomes increasingly important. So what specifically does the research tell us about the importance of physical environments in ECE settings? After analyzing decades of ECE research, I can confidently say, not much. Most of what we know about the importance of childcare spaces comes from research in fields other than ECE, like architecture, childhood development, education, environmental psychology, physical and mental health, and sustainable design. There is ample knowledge of what the issues are and why they are important. And to be fair, ECE research does acknowledge the significance of physical environments and that high quality care correlates with healthy development. The issue is that the importance of physical environments is not reflected in the licensing regulations and facility standards that govern these ECE spaces. When we started this project, we wanted to understand what specific attributes of physical space help children thrive. What we discovered was that most space-based regulations aren't sufficient enough for children to survive. After looking at a handful of states, we expanded our investigation to include all 50 states and DC, comparing how they regulate basic needs in ECE spaces like natural light, safe drinking water, abatement of harmful toxins, crowding, and outdoor space. I was truly unaware of what I now know to be fact. The licensing regulations and facility standards that govern ECE spaces vary wildly by state. For example, in 2019, only 11 states required licensed childcare facilities to test their drinking water for lead. And in 2015, only 1/3 of states' childcare facility regulations even addressed asbestos. The data plainly shows that exposure to environmental hazards and toxins like asbestos, lead, mold, and radon can have devastating effects on childhood development. Nevertheless, licensing regulations in most states distinctly lack these provisions. And to make matters worse, most Part Day programs and programs affiliated with religious institutions are exempt from regulatory compliance completely. And while our research focused on state regulations for center-based ECE spaces, we would be remiss not to recognize how greatly states differ in their approach to requiring licensing oversight for home-based settings. When one considers that the state standards are supposed to represent basic protections for children, it is evident that many children do not receive any protection from the state at all.
Thank you for that, Maggie. So like Maggie, I was also relatively new to this work. I began working at LISC in early 2021, and I did not have experience in the childcare sector prior to that. One critical learning experience for me in this project was navigating the tension between the urgency of meeting basic needs in facilities and the frustration born of the fact that basic needs are not enough for children to truly thrive, learn, and develop healthily. For this project, we have been lucky to work with an architect partner, Studio MLA Architects. Studio MLA imagines and helps create spaces that provide the rich learning environments kids deserve. The concepts in these slides may seem more lofty than square footage, but we should keep in mind how much room there is too between a minimum square footage and a truly excellent space for diversity of spaces that fulfill kids' needs. This slide exemplifies a welcoming space with lots of natural light and transformability. You can imagine how a few shifts or alterations would provide a wide variety of rich learning environments. We see that in these spaces that there is access to the outdoors in welcoming child scale spaces. We also see how these spaces provide access to nature, different sensory experiences, and all at a child scale, which empowers kids and help them control their own learning experience. Just going to scroll back again through some of these spaces as you consider these different and potentially new concepts. Child autonomy is key to another concept that Studio MLA investigates, trauma-informed design, which strives to create spaces of safety and empowerment that take into account the trauma that occupants of a space have experienced. This is particularly important for children in low-income communities and communities of color, many of whom have experienced neighborhood and society level trauma due to systemic racism and disinvestment. Much of good design is also trauma-informed design. To point out just one example, this reading nook provides a private space for children who need some quiet alone time, which is critical for emotional regulation in the face of triggers and other stress. Community context and the context of existing spaces is important to take into consideration. Although kids need the same conditions to thrive no matter where they are, and licensing and regulation should reflect this, there is no question that a family child care in New York City is working with different space expectations than, say, a center in Portland, Maine. There are also different considerations between urban and rural settings. And of course, cultural context is also important. For this reason, all great spaces don't have to look the same. Ideally, regulating entities, funders, and TA providers could work with care providers to determine what works best for them in their particular context. Now I'm going to hand it back over to Maggie, who will talk about how wildly actually existing regulation does vary by state.
Thanks, Cecile. I really, really love that reading nook. Okay, so here's a snapshot of how some states regulate crowding and square footage in ECE spaces. Most jurisdictions regulate indoor space at 35 square feet per child, even though all of the available research shows that this is insufficient, in addition to not accounting for adults in the space. In fact, all bodies of existing research show that the standard should be at least 50 to 60 square feet of indoor space per child. This means that most of the current state ECE licensing regulations are actually legislating and enforcing inadequate classroom design standards. In considering that 35 square feet of indoor space per child is a subpar bare minimum standard, some state standards like Florida, Texas, Alabama, and my personal favorite, Ohio, seem to be based solely on whatever policymakers deem to be adequate for children. It begs the question, who are these regulations serving if they do not take into consideration what is best for healthy childhood development? As we all know, COVID amplified the need to plan for enough space. Here's a floor plan of an average space in most geographies that's licensed for 20 preschoolers. If by some miracle, all of the children strictly followed the social distancing guidelines, there is barely enough space to accommodate half of them. Also, these indoor space regulations do not account for the staff to child ratio, which would require 2 to 3 teachers, or for the parents and caregivers that would be moving in and out of the space throughout the day. Similarly, most jurisdictions regulate outdoor space at 75 square feet per child. For context, 75 square feet is equivalent to about half the size of a standard parking space. At this point, conventional wisdom tells us that crowding is bad. So why is crowding not sufficiently mitigated universally in state regulation?
Sorry for my kind of slide wildness there, but thank you, Maggie.
No worries.
This divergence state to state also creates a deeply frustrating experience for providers who are hoping to open or improve a facility. Childcare providers are disproportionately women, and a majority are people of color, groups that have historically faced systemic barriers to accessing capital. As we identify in our report and our toolkit, financing sources for childcare facilities are disparate and often have Byzantine requirements, forcing providers to become real estate and finance experts in their obviously copious spare time. We want to be clear that we are not criticizing providers for not having better spaces. Providers want and need more resources than they are given. Regulation is often punitive and doesn't provide providers necessary support. This can especially impact family or home-based childcare providers, who often face additional and unique challenges with licensing and are not taken into account in much of regulation. This makes it extra challenging for home-based providers to improve their spaces and get what they need in terms of funding and resources. Maggie is now going to tell us a little bit more about disparities in information access on regulation.
While some states have sought to develop new governance structures that consolidate authority and oversight of ECE programs and services under one roof, the current systems of governance in most states are typically dispersed through multiple agencies and departments. After deciphering which state agencies and departments regulate and oversee ECE programs and services, the next step is to thoroughly review state regulations to determine agency compliance and inspection systems, a task that is much easier said than done. Child Care Licensing Bureau websites and licensing regulation websites are often maintained by separate entities, making them difficult to find and navigate. ECE licensing regulations are typically embedded in state administrative codes, which are not easy to read and interpret. In addition to licensing requirements, ECE programs must comply with building code, fire safety, health and sanitation codes, environmental inspections, and local zoning ordinances. In my naivety, I was actually surprised by the lack of agency coordination for these various requirements. I thought there's no way a state and local regulation structures would impose contradictory requirements on providers. I was wrong. Likewise, states' consumer education websites can be difficult to find and navigate. Consumer education websites may provide information about childcare assistance, but the information to help families find affordable childcare options and other financial support options is very limited. Unfortunately, the process can be exclusionary, as not all states' websites accommodate language access. The bottom line is states' consumer education websites and childcare search options are insufficient at helping meet the unique needs of families and children. In terms of geographical and neighborhood access, many conditions are extremely challenging to mitigate. And while we may not be able to prevent the severe consequences of environmental injustice in vulnerable communities, we can ensure that the ECE programs operating in these communities are as safe as possible. As we think of revisioning ECE spaces, it is imperative that we work together to continue to develop and expand a multi-dimensional definition of quality. Quality spaces that support children to feel safe, free, and secure may look different in different settings. Back to you, Cecile.
Thank you, Maggie. So we also conducted a survey of experts in the childcare industry, and this effort was led by our national director, Cindy Larson at LISC, who could not be with us today. But I wanted to share some characteristics nonetheless of those surveys. So some of the people that we surveyed were involved with policy, leadership efforts, staff members of various initiatives or organizations, funders involved with government or oversight, etc. And so, as you can see from the pie chart on the right, these folks have a lot of experience in the field. This is a word cloud of what came up for these experienced folks when thinking about facilities. We see some negative words front and center: underfunded, lack, adequate, insufficient. A lot of key issues and keywords that we found in our project appear here as well. The majority of experts surveyed agree that there is credible research of a causal relationship between space and child outcomes. You can also see here that the majority of respondents believe that less than 50% of childcare centers in the US meet or exceed basic health and safety standards. When surveyed about the most important features of a space, the most respondents said quality outdoor space, followed closely by appropriate sized areas for play, activity, rest, and learning, as well as natural light. And so you can see a number of other aspects here: waters and sinks in classrooms, bathrooms in classrooms, clean, hygienic, healthy, and safe spaces, child height windows, etc. So after reviewing all of the information that we compiled, the research, the surveys, and everything else that we have covered, we moved to creating a toolkit for action. So in thinking about action, a critical set of prior efforts to look at is the creation of childcare facilities funds. And so this is an area of research that, again, our director, Cindy Larson, spearheaded. So I'm just going to quickly review it. But throughout the nation, there have been coordinated efforts to create child care facilities funds, which are public and private initiatives to marshal resources and funding and technical assistance to support providers with facility developments and improvement. We can see here a headline from the Los Angeles Times on facility funds efforts, and a couple of snapshot excerpts from our interactive report, which will be coming soon to our LISC childcare website. So examples of facility funds efforts can be found across the US. We have this great map of just a few examples. You can see, clicking on California, there's a bunch of things. Here in North Carolina, Here in New York, North Dakota, there's some ARPA funding from the COVID related fund, emergency fund. And yeah, there'll be an opportunity for you to further explore this map again in our interactive report, which is coming out to the public super soon. So with that sampling, moving on. This is also an excerpt from that soon to be released report. Again, you'll be able to find that on our LISC childcare and early learning website. I'll provide a link to that at the end of this. One thing that successful facility fund efforts have in common is vocal, passionate champions for the cause. So individuals who believe that a household's economic situation should not determine the quality of childcare facilities that their kids have access to. These champions could be educators and architects, community development professionals, government officials, funders, physicians, but all of them share a compelling belief that space matters. Facilities funds have not focused on all provider types equally, which is important to acknowledge. And so because of this, not all providers have had equal access to these resources and efforts. Currently, there is no dedicated federal source of capital accessible to all provider types in all communities to assist with infrastructure needs. And so National Children's Facilities Network and its member organizations so passionately support the establishment of dedicated public sector resources for early childhood education facilities. You can find more information about that on the website of the National Children's Facilities Network, or NCFN. So what are the next steps? What do we do with all of this? So looking at the Child Care Facilities Fund efforts, just looking through all that map, except we know that successful geographies do exist. We've also seen numerous examples. We've seen photos of the good spaces that have existed and that people have made. So we must look to these successful places and spaces for models and find our champions and advocates who will drive broader change at the systems level. As CDFIs, we also must look to changing the narrative around childcare and community development. Childcare facilities are an absolutely essential piece of community development, which you will learn when you talk to anyone in a community who needs childcare. Co-location models, where childcare is paired with housing or other community facilities or uses, are one way to actualize this reality. We also need to change the game of information access and advocate for the kind of funding and technical supports that providers need and are asking for. We are hoping that our new toolkit will be a key part of this change. The Making Space Matter platform, here we have a screenshot, a sneak preview of what it will look like, is a concrete, interactive, step-by-step guide to help craft childcare and early learning facilities policies of the future. Our innovative toolkit walks users through assessing their existing state system of supports for childcare facilities, covering all of the interconnected pieces that are needed to create meaningful and sustainable change. By the end of the module, leaders will have the information and tools they need to develop a detailed, actionable plan, using the categories of data and information, funding, policy, regulation, partnership, and technical supports. Anyone who's interested is welcome to use the toolkit, but it was designed with the following audience in mind. It was designed for state administrators overseeing childcare and early learning policies and funding streams, state regulators, governors' offices, local jurisdictions, state and regional economic development authorities, advocates, and funders, and other market leaders. This toolkit will be released to the public by December 2022 and can be found on the LISC Childcare and Early Learning website. We very much look forward to your use and your feedback. And finally, we would love to leave you with some food for thought. Consider these questions in the wake of our presentation based on the information we have here and any knowledge or experience you may have as well. The first question, as we can see, the research on this issue is settled. So why hasn't anything changed? How do we elevate this issue more or better? Do you have an example of how regulations can be adequate or misaligned with need based on your experience? And how would you improve it? And so with that, I want to thank you for listening and watching this conversation, and we hope to continue to have all of you in conversation with us on these critical issues as we charge ahead. You can find us at the link. And thank you so much to Maggie for joining me today.
Thank you so much to Cecile and for everyone joining us today. We are clearly passionate about ECE spaces, and we hope you will join us in making space matter. Have a great day.